Dear colleagues, we're about to wrap up, but we have some questions to the previous speaker. And could you show us Tatiana? Oh, very good. Tatiana, very happy to see you. So that was very interesting presentation, and we were all thrilled by that, actually, because right now, after COVID, we are all in depression to a certain extent, as well as our patients, and we see that they really difficult and have and struggling with that. So about 10 years ago, I had one interesting publication. I think that was American study, and they showed that glaucoma patients that were taking antidepressants had a lower progression rate versus those that were not taking antidepressants. But on the other hand, antidepressants may not be indicated to all glaucoma patients. So, in fact, what can you recommend for the treatment of our glaucoma treatments? Maybe some tableted forms, or maybe some other ways, maybe daily regimen, meditation or something else.
Наталья Ивановна, спасибо большое за
Natalia,
интерес
thank you
к
very much
докладу.
for the interest to
Спасибо
my
за вопросы.
presentation, and thank
На
you very much
самом
for the
деле
questions.
депрессии,
In
наверное,
fact,
сейчас повержены более,
right now,
можно так сказать,
depression
каждый
could be
пятый
diagnosed
человек на планете.
in every
И
fifth person in
естественно,
the
что
planet, regardless
наличие
glaucoma. And
антидепрессантов
definitely administration
должно
of
быть после
antidepressants
консультации
should be done only after the
психиатра.
consultation
Это
with
достаточно
psychiatrists.
серьезные препараты,
And
тем
these
более,
are quite
что
serious treatments.
исследования последних лет
And
доказали,
the
что
studies of the recent years
мучительные, как
proved that
рецидивы,
they're
как
not as
заявляют,
effective
по
as
крайней
it is
мере,
always declared, well,
производители.
at least by
Поэтому для
manufacturers.
пациентов
So
с
that is why,
глаукомой и вообще
for
для
the patients
всех,
with
кто
glaucoma, and
подвержен
actually for all
каким-то
those
депрессивным
who
настроениям, мы
who are
рекомендуем
prone to these
все-таки, во-первых,
depressive mood
соблюдать
changes, first of all,
правила
we
гигиены. Что
recommend
это
to
значит?
stick to
Это
circuit
значит
hygiene. What
все-таки
does it mean? That
стараться
means to
солнцем
wake up
ложиться
early
в
and
заходе.
go
То
back to
есть
bed with the sun as well.
поменьше
So that
пользоваться
means
солнечным светом,
have a
побольше
lower rate of
естественного
blue light
солнечного
gadgets,
освещения, когда каждый
being
раз даже
outside on
выходя
fresh
из
air, as we
источника,
proved in our
когда многие
publication, and it has also been
исследования,
proved by
что
multiple
это
multi-center
влияет
studies
на
that light
настроение
may
и
positively
снижает
influence
уровень
the mood
депрессии.
and to
Не
reduce the
случайно во
level
всем
of
мире
depression.
применяется свет
It is not
дневной,
accidentally that
чтобы
light treatment
действительно.
or helio
Кроме
treatment
того,
is actively
ученые
used
уже
all over the
доказательно о
world.
том,
And
что пациенты с
besides, I would
глаукомой
like to
должны
mention that patients with glaucoma
нормализовать свой ритм дня
should
и улучшить
normalize
сон.
their
И
daily
действительно,
regimen and to have
ученые
more
доказали,
sleep.
что
Well, our Spanish colleagues have
каждый
proved that
пациент с глаукомой
every
спит
patient with
меньше
glaucoma
нормы где-то на
is
60
sleeping less
минут.
than norm, about
Это
60 minutes,
увеличивает прогрессирование
and it increases the
заболеваний, как
progression
атеросклероз,
of such diseases like
нейроdeгенеративных
atherosclerosis and
заболеваний.
diabetes
Ну и,
mellitus.
наконец,
And last
регуляция
but not least,
мелатонина. И как
melatonin options like
мелоксин, циркадин
melatonin,
и
circadine,
растительные
and
аналоги,
other
они также могут
plant-based analogs. So
нормализовать
they also can be
ритм
helpful
сна
in the normalization of
глаукомы.
the sleep
И мы еще,
rhythm in
конечно,
glaucoma.
рекомендуем
And
практику
definitely, we also
релаксации,
recommend
йога
practical
терапию,
relaxation, yoga
включая, если вы
treatment.
работаете в том
And
числе
there are such publications
курсах
that after the
медитации,
course of
йога-терапии.
meditation and
У
yoga
пациентов
treatment,
нормализовалось
there
индивидуальное
was
давление,
normalization of
снизилась
intraocular
тревожность.
pressure and
И,
anxiety
конечно
attacks
же,
were
для
reducing.
врачей
And
очень
also
важно
for the
является
doctors, it is
просто
very
доброе отношение к
important
пациенту и
simply
с
to
тем,
have kind
и
attitude to
лечение
patients, to talk to
родственников.
the
Все
patients, to
вместе
involve
могут,
relatives, family,
это
friends.
позволит нашим
And in
пациентам
complex
легче
altogether, it will
справиться
help our
с
patients to
ситуацией
manage
стрессовой.
the psychological
Спасибо
stress.
большое.
Thank you.
Татьяна Николаевна, большое спасибо. Вот на этой
Tatiana, thank you very
светлой ноте,
much. And
наверное,
with
мы
this
тогда и
very
закончим
positive
нашу
note,
дискуссию, потому что
we will
наш уже эфир
finish our
приближается к
discussion
завершению,
because
благодаря очень
we have
многообразным.
already
Но,
depleted
коллеги,
the
я бы
time we
хотела
scheduled. But
завершить наш вебинар
I
не
would like
подвести
to
итоги.
finish
Вот
our
сейчас я
webinar and to
попрошу
sum up.
показать
And
телеслайды,
I want
на
to
которых
ask
как раз
our
сейчас
technical
традиционно
support
мы
team to
подводим
show
итоги
some
всем докладам.
wrap-up slides
Итак,
where we
первое,
sum
на
up
что я
all the
обращаю ваше
presentations.
внимание,
So
что
first thing, I
нейродегенерация
draw your attention to the
оказывает
following.
влияние
Neurodegeneration
как в
covers a
состоянии
number
нервной
of
системы, так и
diseases,
органов
both in
зрения, слуха,
CNS and
кожи
the
и мозга.
visual
И
organs.
выявление этих
Glaucoma is
заболеваний
among
на
them. So
доклинической стадии
identification of
любыми
these diseases
способами,
at
будь то
preclinical
лабораторные
stage with
тесты,
anyway,
скрининги,
laboratory tests,
визуализации,
screenings,
обеспечит хороший,
visualization,
по
so
крайней
it
мере,
could
лучший
provide good
прогноз в
or let's say
дальнейшем.
better prognosis in the future.
Покажите, пожалуйста, следующий вывод. Или я буду сама, наверное, листать. Да, да.
By now, we've reached new understanding of pathogenesis and neurodegeneration, and the big role belongs to the neuroinflammation and autoimmune disorders. Neuroplasticity of the brain that was covered by academician Ugrumov is a very important and very perspective area for future studies. Keeping in mind this connection between mitochondrial dysfunction and neuroinflammation, the new strategies of neuroprotection in glaucoma should be focused on mitochondrial dysfunction, and neurotrophic treatment plays a very important role in the neural protection and focused on the neuronal protection from all other factors causing neurodegeneration. Medical neuroprotection is the safest and feasible in glaucoma at the moment, and even multiple drops for the pressure reduction, especially brimonidine, latanoprost, aflatan, provides evidence-based, but only in experiment, direct neuroprotective effects. Very important role belongs to the vascular dysregulation, and Professor Wang was speaking about it today. And in glaucoma treatment, we should keep in mind the role of vitamins group B, specifically B3 and less about B12. So that's new and very interesting information about vitamin A, and also about the regulation of immune dysregulation, even laminar cribosa gradient of pressure with vitamin A. And this is very new and very important information. So a very reasonable approach to the neuroprotective glaucoma treatment from the theory of constitution, but this is Chinese medicine that we do not master, but that's very interesting. A neurobiological component of glaucoma pathogenesis was proved related to the changes of the circadian system. So in the scheme of treatment, we need to include methods of relaxation, drugs for the normalization of sleep, light therapy, and we should care about circadian hygiene that Tatiana was speaking about. New ways of introductions of drugs, including nanotechnologies, in the perspective would extend the opportunities of neuroprotective treatment of glaucoma. With that, I would like to thank you. Thank you for your attention, for your patience, for your interest, for your time. So we're very proud of this webinar. We were talking about very complicated pathogenesis. What we do believe that this session was interesting and useful, and hopefully you will be able to go back to the recordings. You can enjoy them at our website. With that, we thank you for your attention. I thank my co-chair. Thank you very much, our colleagues. We wish you a very good day, all the best, and goodbye.